Assalamualaikum warahmatullahi wabarakatuh. My name is Jufri Fikri bin Jamaludin. So today I will be presenting my DRP slide. The title of my research is the effectiveness of spot massage and dry cupping on pain scale and range of motion in sedentary adults with non-specific lower back pain. These are the content that will be in my DRP, which are introduction, problem statement, objective, hypothesis, literature review, methodology, and references. First of all, I will start with my background of study. Lower back pain is the most common musculoskeletal condition that can be faced by office worker, sedentary adults such as office worker and students. This is because there are high risk of non-specific lower back pain due to prolonged sitting and low physical activity. So, there are few non-pharmacological therapy to improve or to reduce the risk of lower back pain, which is spot massage and also dry cupping. Spot massage can help to reduce the muscle tension and improve the blood circulation, same as dry cupping, because the dry cupping use negative pressure to improve the blood flow and reduce the soft tissue tightness in our lumbar region. Based on previous study, there are reported few or several positive effects of spot massage and dry cupping on reducing the pain and also increase the mobility of our body. Now, I will continue with the problem statement. For my problem statement, this because of sedentary lifestyle and prolonged sitting position can increase the risk of non-specific lower back pain and reduce our lumbar region mobility. And there are several manual therapy that can help us to reduce the risk, which are spot massage and dry cupping. The problem for this research is the previous study show positive effect, but the results are inconsistent. This is because of the different protocol and short treatment duration, and there are also lack of evidence or research that are comparing between spot massage and dry cupping, especially among sedentary adults with non-specific lower back pain. Because of inconsistent due to different protocol can make the result are very different, because the outcome will be changes every time you change the protocol, and the limited research cannot give the enough or strong evidence to know which are more effective. It can be spot massage or dry cupping that are more effective to overcome the problem, which are non-specific lower back pain among sedentary adults. Now, I will proceed to the purpose of my study. The purpose of this study is to compare the effects of spot massage and dry cupping on pain level and lumbar range of motion or ROM among sedentary adults with non-specific lower back pain. So, I will continue my presentation with research question. I have divided it into two, which are descriptive and also difference. For descriptive, the first research question is what is the pain scale score of sedentary adults with non-specific lower back pain. The second descriptive question, what is the range of motion of sedentary adults with non-specific lower back pain. Now, I will move to the different research question, which is there any difference in pain scale and range of motion following the spot massage among the sedentary adults with non-specific lower back pain? And the last research question is there any difference in pain scale score and range of motion following the dry cupping among the sedentary adults with non-specific lower back pain? Move to the research objective. There are 4 objectives for my research. The first objective is to measure the effects of spot massage on pain scale and range of motion among the sedentary adults with non-specific lower back pain. The second objective is to measure the effects of dry cupping on pain scale and range of motion among the sedentary adults with non-specific lower back pain. And the third one is to compare the effects of spot massage and dry cupping on pain scale score in sedentary adults with non-specific lower back pain. Last, for my research objective is to compare the effect of spot massage and dry cupping on the range of motion among the sedentary adults with non-specific lower back pain. These are the hypotheses of my research. There is no significant difference in the mean pain scale score before and after the spot massage intervention among sedentary individuals with non-specific lower back pain. The second hypothesis, there is no significant difference in mean lumbar range of motion before and after the spot massage intervention among sedentary individuals with non-specific lower back pain. The third, there is no significant difference in the mean pain scale score before and after the dry cupping intervention among sedentary individuals with non-specific lower back pain. And the last hypothesis is there is no significant difference in mean lumbar range of motion before and after the dry cupping intervention among sedentary individuals with non-specific lower back pain. The last two hypotheses are there is no significant effect between spot massage and dry cupping on pain scale score among sedentary adults with non-specific lower back pain. And the last hypothesis, there is no significant difference effect between spot massage and dry cupping on range of motion score among sedentary adults with non-specific lower back pain. These are the literature review of my research. Most of my literature review, the population is quite similar to my population. And the key finding is significantly about dry cupping and also spot massage or manual therapy that can help to reduce the lower back pain. Now, I will proceed my presentation with my methodology. I will start with my research design. I will use crossover experimental design because there is only one group that can do two interventions, which are spot massage and also dry cupping. For my sampling technique is purposive sampling because I have inclusion and exclusion criteria during my recruitment and screening session. For inclusion criteria, there will be sedentary who sit more than 6 hours and the age range is between 18 to 45 years old. They need to experiencing lower back pain at least 3 months and the pain scale score need to be above than 3. If below, I will reject. And they need to currently not receiving any treatment. For my exclusion criteria, I will exclude the participant who have history of spinal injury, the presence of skin problem, pregnant woman, individual with bleeding, and also the individual who are involved in regular exercise or rehabilitation programs. This is my sample size. My sample size is based on Zhang et al. 2024 journal. My sample size was determined by using G-Power software for limited measure ANOVA. My effect size is 0.36 with 2 number of group. The power is 0.8 and the total sample I get is 20%. Proceed to the intervention. I have 2 interventions which are spot massage and dry cupping. For spot massage, I will target on lumbar and lower back muscle, and there will be 3 techniques I will use, which is infrared, petrissage and also friction. The duration for spot massage is only 15 to 20 minutes and it will be conducted only in single session. For dry cupping, the target area is the lumbar region and the technique used is manual pump. The duration for the cup is 10 to 15 minutes and I will use only 4 to 6 cup and the frequency is same as the spot massage, which is single session. These are the instrumentation that I use in my research, which is pain scale score by using visual analog scale or VAS, and lumbar range of motion by using goniometer for lumbar flexion and also lumbar extension. These are the protocol for visual analog scale. The visual analog scale consists of 10 cm. The pain scale will be 0 until 10. The 0 is no pain and the 10 is the worst pain. The pain score will be recorded before the intervention to assess the treatment and after the intervention to assess the treatment effects. For the lumbar range of motion, by using the goniometer, I will use for lumbar flexion and lumbar extension. These are the lumbar flexion protocol and also lumbar extension protocol. Now, I will continue my presentation with data collection procedure. My data collection procedure will start with ethic approval and move to the recruitment and screening session. In this phase, I will make sure all of my participants have the inclusion criteria and do not have any exclusion criteria. How I want to justify or identify my patient have lower back pain or not, I will conduct a special test, which is slump test, and perform piriformis stretch. If they are showing positive sign and symptom, so they are having lower back pain. And then, I will go to the pre-test measurement for my baseline. In the pre-test measurement for my baseline, I will go for pain scale score by using visual analog scale and lumbar range of motion protocol by using goniometer. After that, we will proceed with the manual therapy, which is spot massage and dry cupping. In between of spot massage and dry cupping, there will be washout period for 72 hours or 3 days, just to make sure there will be no carry forward afterwards. After that, after having the manual therapy, each patient, I will take their post-test measurement. After that, I will identify and justify which manual therapy is the most effective to overcome lower back pain. Data statistical analysis. Descriptive statistic, mean and standard deviation will be used to summarize my participants' characteristics and study variables, which are pain scale score and lumbar range of motion. I will use repeated measure ANOVA within between interaction to determine the effect of time between pre-test and post-test, the effect of group, spot massage and dry cupping, and also the interaction effect between time and group. The post-hoc analysis will be conducted when significant differences are detected and the level of significance will be set at p less than 0.05. And this is the Gantt chart that will show my activity along my preparation for my research. My research is conducted from the October and until 2026 July. This is the references that I use along preparing my defense research proposal, and there are 8 references I use. That's all for my defense research proposal. Thank you very much.